I'm Michelle Aubin. I am an orthopedic surgeon that specializes in hand and upper extremity surgery at Allegiance Health. When I was little, we're talking kindergarten, I used to walk around the playscape with a little plastic doctor's kit that had Band-Aids in it. And if someone was going to fall and scrape their knee, I was going to be the one to put the Band-Aid on. And unfortunately, they all went to the nurse, and I didn't get to do that. But from the time that I was little, I wanted to be a doctor. And when I was in middle school, I started having problems with my shoulders. They would dislocate or pop out during sports. And my orthopedic surgeon became my mentor. I followed him in clinic, I followed him in the operating room, and I decided that's what I wanted to do. I wanted to work with my hands, I wanted to make people better, and have real tangible results. Broken bone, fixed bone. And then in medical school, I rotated through all the various professions and decided orthopedics is definitely the way I wanted to go. And once I was in orthopedics, I decided to narrow that down to hand and upper extremity surgery because it let me be very, very good at one specific area and yet get to do all different types of things in that area. I get to work on nerves and bones, fix fractures. I work with little babies. I work with elderly patients and athletes. And so in hand surgery, because I can do everything, fractures, arthritis, torn ligaments, tendonitis, I really felt like I was getting to do a lot. I wouldn't get bored, and yet I'd be very, very good at what I did. So I perform all surgeries from the elbow to the hand, or that's what I specialize in. So that would involve fracture surgery, putting bones back together with plates and screws. That would involve tendon surgery. If you get a laceration and your tendons aren't working anymore, I can put those back together or fix those. Or if your tendons are irritated, sometimes that's managed without surgery and rarely it's managed with surgery. I can address that too. I also deal with nerves, so if your hand is numb and tingly or weak, that can be a nerve problem that I would address, or the same thing if you were to get a cut and cut your nerve, I would repair your nerve. If you're playing sports and you injure your wrist in sports and you have, say, a TFCC injury is a common one. I do wrist arthroscopy both to be able to look in the wrist and find out what's going wrong, but also to potentially provide repairs through the arthroscopy as well. Well, first, there's a need for hand surgery here. And I met with Dr. Beekman, who's an outstanding hand surgeon, and he sold me on this place. And every single person that I've met here has been good at their job, but also very personable and easy to talk to and really cares about you. And so that was the first factor that really drew me to coming out here. But I'll be able to work with all types of people and join this wonderful community and provide excellent hand surgery, and that's what I'm looking to do. I want patients that need me, and that's what Jackson has.